Do penis extenders actually work? Can a device that pulls on the penis really make it longer? Or is this just another internet promise that sounds good but rarely delivers real results? If you search online for ways to increase penis size, one of the first things you will find are devices called penis extenders. These devices are marketed as a non surgical solution to increase penis length. You will see advertisements claiming gains of 2 centimeters, 3 centimeters, sometimes even more. The idea sounds simple: attach the device, apply traction, wear it several hours a day, and over time, the penis supposedly grows longer. But the real question is this: is there scientific evidence supporting these claims? Do penis extenders actually work? And perhaps even more importantly, what risks do these devices carry? Because when it comes to male sexual health, many treatments are marketed aggressively online. But marketing is not the same as medical evidence. In this video, we are going to analyze the truth about penis extenders. We will talk about how these devices are supposed to work, whether scientific studies actually support their effectiveness, what the real expectations should be, and most importantly, the potential complications and risks that many people never talk about. But before we go deeper into this topic, let me briefly introduce myself. My name is Dr. César Noval. I am a plastic surgeon specialized in male sexual surgery, including penile enlargement procedures and gender surgery. I am also the director of Clínica NEF, where we treat patients in Spain, Mexico, and Miami. Our medical team specializes in advanced techniques for penile lengthening and girth enhancement, and we have treated patients from many different countries around the world. Our main YouTube channel, Clínica NEF in Spanish, already has more than 100,000 subscribers, where we publish educational content about male sexual health, penis anatomy, erectile dysfunction, and surgical treatments. This English channel was created using artificial intelligence technology so that we can bring the same medical information to a global audience. Because male sexual health is still surrounded by myths, misinformation, and unrealistic expectations, and our goal is to provide clear medical information based on science and clinical experience. Now let's talk about penis extenders. Penis extenders are devices designed to apply continuous traction to the penis. They typically consist of a base ring that sits at the base of the penis, two adjustable rods that extend forward, and a mechanism that holds the glands in place. The idea behind these devices is based on a concept called tissue expansion. In medicine, controlled traction can sometimes stimulate tissue remodeling. For example, in orthopedics or reconstructive surgery, traction devices are occasionally used to gradually stretch tissues over long periods of time. Because of this concept, manufacturers of penis extenders claim that applying traction to the penis can stimulate tissue growth and increase length. However, there are several important issues that must be considered. First, the penis is not designed to tolerate prolonged mechanical traction. The erectile tissues are delicate vascular structures. They depend on healthy blood flow, nerve function, and connective tissue integrity. Applying continuous traction to these tissues can potentially interfere with normal circulation. Another issue is that most studies evaluating penis extenders are small, poorly controlled, or sponsored by manufacturers. While some studies suggest minimal increases in flaccid length, the results are often inconsistent, and in many cases, the changes are very small and not clinically significant. More importantly, many of these studies involve highly controlled conditions where patients use the devices exactly as instructed. In real life, the situation is different. Most users find these devices uncomfortable. They may stop using them after a short period of time, or they may use them incorrectly, and improper use significantly increases the risk of complications. One of the most common problems associated with penis extenders is pain and discomfort. The traction applied to the penis can cause irritation in the glands. The glands is the most sensitive part of the penis, and prolonged pressure on this area can lead to numbness, irritation, or bruising. Another frequent issue is skin injury. The straps or loops that hold the glands in place can sometimes compress the skin excessively. This may lead to redness, swelling, or even small skin lesions. In more severe cases, prolonged traction may cause vascular compression. When blood circulation is restricted, tissues may not receive enough oxygen. This can result in swelling, discoloration, or tissue damage. Some users also report nerve irritation. The penis contains delicate nerve structures responsible for sensation. Continuous traction can sometimes irritate these nerves, causing numbness or altered sensitivity. In our clinical practice, we occasionally see patients who have experienced problems after using traction devices. Some develop chronic discomfort, others develop visible deformities caused by uneven stretching of the tissues. And in rare cases, excessive traction may contribute to fibrosis, which can lead to curvature problems similar to Peyronie's disease. Another issue that many people do not consider is the psychological impact of these devices, because manufacturers often advertise dramatic results. When users do not achieve those results, they may feel disappointed or frustrated. This can lead to increased anxiety about penis size, and anxiety itself can negatively affect sexual performance. This is something we see frequently in patients. Men become so focused on achieving unrealistic size expectations that they overlook more important aspects of sexual health, such as erection quality, confidence, communication with their partner, and overall well being. It is also important to understand that penis size is largely determined by genetics and hormonal development during puberty. Once adulthood is reached, the anatomical structures are relatively stable. Significant permanent changes are difficult to achieve without medical intervention. That does not mean that every man who worries about penis size actually has a problem. In fact, studies consistently show that the average erect penis length is approximately 13 to 14 centimeters, or about 5 to 5.5 inches. Yet many men believe they are below average. This perception is often influenced by unrealistic images in pornography or online media. In reality, most partners care far more about emotional connection, intimacy, and communication than exact measurements. So, when discussing penis extenders, it is essential to approach the topic with realistic expectations. There is no strong scientific evidence showing that these devices produce significant permanent increases in penis size. The potential benefits are uncertain, but the risks and discomfort are real. For men who are concerned about penis size, the best approach is to seek professional medical advice. A qualified specialist can evaluate whether the concern is anatomical, psychological, or related to sexual function. And if treatment is appropriate, it should be based on safe, medically validated techniques. At the end of the day, male sexual health is not just about size, it is about confidence, function, communication, and overall well being.
If you found this video helpful and you want to learn more about male sexual health, erections, penis anatomy, and medical treatments, make sure to subscribe to the channel. Our goal is to provide clear, honest medical information based on science and clinical experience. Because understanding your body is the first step toward improving it.